And good afternoon, everyone. TJ Alds, I-45 now and Galveston now with another edition of Healthcare Unmasked presented by UTMB Health. Glad to have everyone with us. Our first show of 2023 and obviously very appropriate here. We're talking about having a healthier lifestyle. And of course, a lot of folks, that means you've got your New Year's resolutions. You're out there, you're dieting, you're not drinking, you're on the treadmill more and the like. But we're going to take this to another step here as we have Dr. Sarah Samarine. She is heading up the bariatric program, the rejuvenated bariatric program, we should say, at UTMB Health. Dr. Samarine, thanks for coming on with us here today. Exciting to be talking to you about this topic today.
It's my pleasure to be here, TJ. Thank you so much. And definitely, this is the right time of the year to get started on a healthier new start.
And one of the things we're going to be touching on a lot here is obviously there are general lifestyle things we're going to give some folks some advice about. But there are some folks, me included, that their weight has gotten to a point where it's that morbid obesity style, and they need a little bit more help along the way here. And that's what you're able to provide through the program at UTMB Health. Full disclosure to everyone here, Dr. Samarine is also now one of my doctors, as you heard me mention here, folks, including me. Now, tell you a little bit, just my story. We're going to get more on that a little bit later. Is that in 2013, I had a gastric sleeve surgery done at UTMB Health. Lost a lot of weight from that, and unfortunately, though, fell out of practice of having those constant visits I would have. And then the program took a hiatus for a while. And but now I'm back in that to go forward there. And Dr. Samarine is my surgeon for this. And I can give you full disclosure here as well. She's a lot of fun to talk to, and also too very pointed and very informative as well. So Dr. Samarine, I appreciate not only being our guest with us here today, but also what already in our short time of knowing each other, what you've brought to the table for me personally. I appreciate that.
TJ, thank you for saying that. And again, I am extremely passionate about what I do. And I think that's why it reflects in what I do. I think it's really important for us to realize that obesity is like any other medical problem that people experience. Honestly, my biggest worry is that somehow there is a stigma associated with obesity that's less with other diseases. When somebody has high blood pressure or diabetes or any other medical problem, we don't stigmatize it the way we do it with obesity, which it's like any other problem and needs treatment. So I'm so glad we're talking about this today.
Yeah, and I should point out that's the same exact message that you gave me when I sat down with you the first time, and it was encouraging to hear from you a positivity as well as a reality check at the same time. We talk about that stigma, and you and I have talked about this back and forth before, but I want our audience to hear this as well, because one of the things that happens is you pointed out that the way we have over the years as a society approached folks who are obese or who need to lose weight is we've treated it as a individual problem and not a disease. Can you talk about why there's a difference there and explain that to folks?
Yeah, I think what has happened is we as a society have not realized that this is not an individual's problem. I think when somebody has some other medical condition, we realize that there are a lot of factors that go into it. But when it comes to obesity or morbid obesity or or being overweight, people consider it as an individual problem. And at the risk of being a little blunt and upfront, people think, oh, if someone has morbid obesity, maybe they're lazy, maybe they're not doing anything right, maybe they're not putting in the work, which could not be further than the truth, because this is a medical problem. People have wide variety of genetic reasons. Yes, lifestyle plays a huge role, but we also can't forget that it's a problem of the modern world. It's not like we're all living in that same environment with the food industry, with the same kind of decrease in physical activity. So we cannot anymore think of it being an individual problem. It's a societal problem. It's a medical condition that over 30% of our society is suffering from. In some, depending on which age group we talk about, we can talk about even 50% of individuals suffering. So it has been treated not the same as other medical problems, and we need to change that. In fact, I think we have the obesity week coming up, right, TJ?
Right. Yeah, that's going to be coming up next month, and we were as we were having our talk on that, there it's coming up in February and goes through March, where that's an actual week that's set aside from a society. You mentioned the Bariatric Surgery procedures. That there's a society that is set up that you refer to a lot for patients to go to. It's the American Society of Metabolic and Bariatric Surgery, that they have a designated week. That's Obesity Week. And also too, that there was an episode of 60 Minutes recently in which there's been a kind of a change, not just in healthcare and doctors looking at this but also insurance companies and the like looking at this different. And we'll come at that a little bit later as well. But first, if I could ask you here so we could address the kind of the top issue, is exactly what is the UTMB Health Bariatric Program do, and what is its mission?
Yeah, so the big mission of the UTMB Metabolic and Bariatric Surgery Program is first and foremost improving your health. This is not about getting to a certain size. It's not about how you look. It's all about being healthy and moving towards the ideal goal that you may have for yourself. It affects all parts of our life, right? From, we had discussed the other day, TJ, like from getting on an airplane to maybe going to a restaurant. There's so many things of our or aspects of our life that are affected by obesity. So the mission of the program is improving a healthier Texas, improving getting us to a better health all around us. And then what the UTMB specific metabolic and bariatric program does is providing you with all the tools that lead to that mission.
Right.
We can go into details of what different pieces we have. But basically, it's not just one size fits all. We really individualize the treatment of obesity to every single patient.
If you just joined us, this is UTMB Health Care Unmasked, our first episode of 2023. And Dr. Sarah Samarine is on with us, and she heads up the bariatric and metabolic program at UTMB Health. We're going to be talking about the details of that program expanding now. As I said, it went on a hiatus for a while and now is just starting up again. In fact, it was just a casual conversation we were having on the show here one day when I discovered that the program had come out of hiatus, and Dr. Samarine had one person working in her office at the time when I called her on this. And we'll have more and be discussing that. Plus, I know I already see questions coming in from our viewers. Not only do we have questions, you also have a fan club, I can tell already, Dr. Samarine, as you've had many patients and friends already chiming in. So we'll make sure we talk to them as well. But we'll have that and more right after this word from UTMB Health.
UTMB Health knows that when you need advanced surgical care, you want a specialist who's an expert in their field. Our surgeons provide innovative and advanced treatment options for adults and children, for neurosurgery, GI, heart surgery, ENT, urology, and more. UTMB knows surgical care. UTMB knows you. To find a UTMB Health specialist near you, visit utmbhealth.com.
And welcome back to the show, UTMB Health Care Unmasked, presented by UTMB here on I-45 Now and Galveston Now. Dr. Sarah Samarini is on with us. She heads up the metabolic and bariatric surgery program at UTMB Health. Glad to have you on, Dr. Samarini. So we found out a little bit about what your mission statement is that goes on. But can you tell me, what type of support is out there if someone is thinking, okay, I really need to look into this, even if it just means I'm going to go in and get some information that can help improve my life. Talk about where we go from where someone goes that may have that idea of, all right, I have this. What's kind of the first step for them?
Yeah, so the first step is talk to your doctor. That may be your primary care, your endocrinologist for those having diabetes, to get you in to see the bariatric clinic. Our bariatric clinic is located in Leak City. It's at the main Victory Lakes building that is right off of I-45, and you get evaluated in the bariatric clinic. Now, I want to make sure that our audience understands that bariatric surgery it's not like getting your gallbladder or your appendix out. It's not, or getting even a hernia fixed. It's not like you come in and we say, okay, yeah, you need the surgery, let's do the operation tomorrow. There's a lot more that goes into the treatment of obesity. We evaluate you and we start a bariatric program. So it's a journey. I like to tell my patients that it's a lifelong journey and we're going to be friends forever. You can't get rid of me. But basically, the program from a pre-surgery standpoint, at that point, once we see you, we determine if you are a candidate for surgery and if you're even interested in surgical treatment. Then we see you once a month, every month. And we guide you through the process of getting you better understanding of nutrition, better understanding of physical activity, and getting mental health support during the process, as well as, of course, medical clearance. We got to make sure this is a journey to get your health improved. So we cannot walk into it without optimizing overall health, right? So if you have heart disease, we got to make sure that you're stable from that. If you have diabetes, we take care of that. And we work with your doctors that you already have. We don't reinvent the wheel. We work with everyone. It's a healthcare team then that takes care of you. And once it takes about 3 to 6 months in the journey. And once you're ready mentally and physically for the big step, that's when we go into the surgery part of it. And we can talk about the afterwards in a second, but basically the biggest thing I want to emphasize here, it's a program. There's certain milestones everyone has to meet, and that's the right thing to do. Making a change is not easy. When I give my patients the example that when we are moving homes, and if we go to a nicer, bigger neighborhood and bigger house, it's still a move. It's hard. Change is difficult. But we want to get you through it and do it right.
One of the things that when you talk about doing it right in the holistic approach here, what would you say early on with this you're seeing of patients or potential patients who come in, sit down in the program, and either decide is that a surgical approach is not the best for them, or you even say probably not the best at this time? And then on the follow-up to that is then what happens? Are they just totally out, or are they able to still to work with you where either get with dietitians or experts to kind of help them walk through that process afterwards, that maybe down the line they'll be more prepared for a surgical approach?
Yeah, so if a patient is determined not to be a surgical candidate, or they themselves at this point are not ready for a step like that, we then send them to our medical program. The medical program is in the works right now. Some of it is being managed by the primary doctors, and I communicate with them. But soon we will be launching an active medical weight loss program that will be located in the same clinic as our surgical piece of the program. And also, that doesn't mean, like, we still have the nutrition support. We still have the mental health support. We have the right resources. So you don't have to go looking, oh, where do I talk? Who do I talk to? Or where do I go?
And in fact, that kind of goes to the overall thought of the program, is to kind of go to a center of excellence status where it's all encompassing. It's
Yep.
about, like the title of our show is, a healthier you or a healthier lifestyle. It is there's not one magical way to do this. That's why you say each individual patient will have a different approach. Yes, it may end up with surgery, others it may not. Or there'll be something that stops that surgery early on, but then comes back at it later. That's the part of building up what you hope to have as a center of excellence status. So kind of explain to us how that's going and where you see that in the next few years.
Yeah. So the Center of Excellence status is going great. There are, and I want to make sure people understand why it's important. Center of Excellence is basically our program is looked over by the Metabolic and Bariatric Surgery Quality Improvement Program, which is a national effort to make sure that we provide the best care to our patients. So Center of Excellence monitors or being a Center of Excellence means that our outcomes are being monitored. We are one of the best in the country. So that we are applying to become a Center of Accreditation in a few months, and we're slated to be applying in June this year. And I'm hoping soon, before the end of the calendar year, we will be achieving that Center of Excellence status. But not to, again, to clarify, we already have all the components that we need for Center of Excellence. So it's not like we're not doing everything.
It's not getting the actual, I call it the logo up there, but everything that you need to have in place is already there and already performing at that level as well. And that's one of the things that I find exciting of this program. Again, having been through it 2013 and then seeing it restart now, and seeing the energy of it. I feel like I'm on the ground floor of something myself as I came through there. I've gone through it so far from there. So now it gets into, all right, I've come and visited you, and I'm talking for not myself specifically, but generically for a patient. Now, how long's the process from that first visit to surgery, if surgery is deemed the right way to go?
Yeah, so at least 3 to 6 months. Can it be longer than 6 months? Absolutely, because we take as long as it takes to get it right with you, to get you ready. So if you tell me in 3 months you're not ready, we're not going to surgery.
Right.
And so most people take 3 to 6 months. It's rare that we run more than 6 months, but sometimes it can happen. So as long as it takes for us to do it safely.
Right. And the idea is that there's meetings along the way. I know I will point out to folks, like last night, I had my phone call, my second consult with the dietitian, which we got to do by phone both times. I didn't have to go to an office. She didn't have to meet me somewhere. We spoke on the phone, and obviously as we do so, there's this actually, I should have brought it in here, and I'll bring it in here a little bit, but I remember in 2013 when I signed up, I basically got a 2-page pamphlet that those were my instructions. And this was, hey, we had to get ready for. Now you've actually give out a little binder that has a guide, a step-by-step guide for everyone, from everything you got to do pre, up and through surgery to post-surgery as well. So someone can go through this and feel better about what they're going to be facing as well.
Oh, 100%. And as part of the binder, so I want to talk about what are some, I know we already talked a little bit about like the milestones of the program that you have to reach: an understanding of nutrition, physical activity. You gotta also have that mental health, be in a good mental health status, and be ready for surgery. But as part of that education and the booklet, we also prepare you for what are the mindful choices that you can make. Then if you want to replace, like say somebody, we think that somebody shouldn't be having rice because of the calories, what can you replace it with? So it's not like, okay, you can't have rice, right? Or go home and you're not allowed to eat this. That's
Right.
not how it works. We gotta give folks education and tell them, okay, if you're not going to do this, do this. All the different options, and the counseling piece of it is very important. And then I think I want to point out that we also prepare them for what to expect after surgery. So it's not like, okay, had surgery, go home, bye. It's
Right.
okay, what should you expect? If this happens, what to do? If that happens, what to do? And we're always available for our patients to reach out to us before surgery, after surgery. We're friends for life.
Yeah, and we've seen that for some folks that have been commenting already. But as you had said during our pre-meeting on Monday, surgery is the easy part. It's the after, the diet. That's the hard part. Folks will say, "Oh, well, I need to work out way more, and I need to do that and all." You say the real key here, when it's all said and done, is diet.
Correct. It's all about what we put in our mouth, honestly. So I'm not discouraging anyone from exercising. It's January. The gym
Right.
memberships are going up, and everyone's making time to be healthier, which is amazing. But it's not only about physical activity. You have to be mindful of what we eat. I tell patients that exercise is great for our heart health, for our muscle strength. But at the end of the day, what determines our weight really is what we eat.
Yeah.
It's all about that. We have to make good choices.
And one of the things that I had found in going through the process now and being able to compare 2013 to now, there's been a lot of advances on where it's gone from saying, okay, you can only eat these types of foods and these types of portions. It is actually, as you said earlier, okay, well, you can't have rice. Let's find something else
Yeah.
that you can substitute with that you will like
Yeah.
too. And I wonder how much of that has changed now, where we're not saying yes, you have to eat cauliflower every day, or it's gone away from that mindset as well, has it not?
So, of course, to some extent. And what I mean by that, the basics would never change, right?
Right.
The basic is healthier eating. What has changed is, before we used to think that anytime you put a carbohydrate in your, like certain people would say, oh, don't have fruits, or like, um, we would stigmatize foods as well. We would say, okay, this is a bad food, this is a good food, or good or bad food. Actually, there's no such thing as that. Everything in moderation. Of course, sugar is one thing. We still say you gotta stay away from sugar. I joke with patients and I say, sugar is for your birthday. So
Once a year.
once a year, exactly. So it's important to realize that basic would not change, but everything in moderation. I tell patients, it doesn't mean you can never have a cookie again. That would be unrealistic, right? But instead of having a full whole cookie, maybe you can have, 1/4 of it. So realizing that moderation is what we are aiming for here. We don't want to take all the joy out of life. That
Right.
is not the right thing to do. I think, TJ, one of the important things that you and I had talked about is having that mindset and preparing yourself.
Right.
So if there's one pearl that I could give our audience today from this whole discussion about diet, the one pearl I have is, you have to think of it as you're not on a diet. It is your diet for life. So it's not like when someone says I'm dieting or I'm on a diet, that implies that this is temporary and you're restricting yourself. That's not the right way to go about it.
Mhm.
We want to make this that it's a lifestyle change. This is how I live. I'm not the kind of person who stops at Burger King, or I'm not the kind of person who's going to eat the whole cookie, or I'm not the kind of person who's going to have this big portion size. I'm going to enjoy my steak, but at a smaller serving size. So those changes, and then bring prepared. Meal prepping, very, very important. Preparation. Life is good to people who prepare.
Right. And that was one of the things that I've already heard from you there. It's like, all right, get all what you need, what it is that you like, what fits into your category, and then prep it all.
Right.
Spend your Sunday to prep it together and have it. And I think more and more folks have gone to that now, where it is where you've got whatever you're going to have for your breakfast or your lunch or your dinner or whatever, you've got it all done, and you've prepped it all for the week. So you take the hard work out early on, and it's not the whole, oh man, I'm tired, I've gotten home from work, I really don't want to have to stir fry the vegetables tonight, or do this with the fish or anything like that. If you've already prepped it, all you're doing is throwing it in, warming it up, and you're set from there. Where you'll go ahead and go, oh, it's already ready for me. And I wonder too, that's kind of those things when society we have now which is, we're so used to be able to go to the fridge and we grab the frozen pizza, throw it in the microwave or the oven, and it's ready for us in 20 minutes. But those meal prep meals that you can do on your own, as well as, yes, there's services out there that'll do them for you and mail them to your house and everything else, but it's actually, you can save some money and do it on your own and just have as much of success with that as buying something else from somebody else, because you have that guide, you have that journey laid out for folks.
Right. And then one question I get from patients is, okay, this is too much work. How do I know the thinking piece of it, not the preparing the food itself? Like, how do I know what to do? Where do I get the recipes? I can't have the same thing all the time. So there are specific bariatric cookbooks that we recommend in the program. So that's an option, that you can have these different cookbooks that can give you ideas to fit your lifestyle.
All right. And there's a lot of guides out there, and we'll talk about those and more. We have Dr. Sarah Samarine, the head of the Metabolic and Bariatric Surgery program at UTMB Health. That's not all she does, by the way. We'll talk a little bit about that toward the end of the show. But we'll be back right after this word from UTMB Health.
UTMB Health knows that when you need advanced surgical care, you want a specialist who's an expert in their field. Our surgeons provide innovative and advanced treatment options for adults and children, for neurosurgery, GI, heart surgery, ENT, urology, and more. UTMB knows surgical care. UTMB knows you. To find a UTMB Health specialist near you, visit utmbhealth.com.
Welcome back to UTMB Health presents Healthcare Unmasked. I'm TJ Alds, along with Dr. Sarah Samarine, the head of the Metabolic and Bariatric Surgery program at UTMB Health. Let's go ahead and address the white elephant in the room right away, right away in this segment, Dr. Samarine, and it is the costs and insurance. That is always the constant debate that goes on here. While we're seeing some changes along the way, folks really do struggle. Like, hey, I've already been told by my doctor this is the best way to go. And yeah, but my insurance is still not working with me. And there's this maze to go on. Can you just talk about the reality check of, one, the cost that someone decides to pay out of their pocket to do all of this, or the process it takes to get with the insurance companies to figure this out? And is there a change? Are you seeing a change within how insurance approaches this, where it used to be considered a vanity surgery versus a healthy surgery that actually does help you in more ways than just be able to put on a smaller pair of pants in the morning?
Right. So I think insurance companies are catching on. They're realizing that it makes more sense for them to pay for the surgery to take care of patients' health rather than have to pay for long-term care of diabetes, high blood pressure, or heart disease. There are unfortunately cancers that are associated with morbid obesity. And so insurances are catching up that it's actually better for even the insurance company itself to pay for patients' surgery. Now, of course, there's still insurance plans that do not cover surgery. I think a big change is happening, but until we have universal coverage for bariatric surgery, it's important that you call your insurance and find out. Of course, our office helps with that. We when a patient is scheduled with us, we do verify insurance. But once that happens, of course, we need to know that you're interested, and that's when
Right.
you may get an appointment from us. But then once we realize the appointment may get canceled, of course, because in case you don't have coverage. So I want to make sure the best way of doing it is that patients call themselves. But if there's a reason you're not able to listen, we're here to help. From a cost standpoint, if your insurance company doesn't cover, UTMB has been great about offering self-pay options that are one of the best I've found in the country. And I'm not saying that honestly, TJ, I'm not saying this because I work for UTMB.
Right.
Because initially I was like, oh, this could be, can we reduce the cost further? So I started calling nationally at different programs, my friends and family that are in other states in the country. And what I found out, we actually have one of the cheapest rates for bariatric surgery in the country right now at UTMB. We haven't changed that cost in many years now. I would say at least upwards of 7 years, we haven't changed the cost of bariatric surgery, self-pay options, even though you've seen how inflation has gone in the country. So I don't want to put exact numbers here because, of course, at the end of the day, as a physician and as a surgeon, my role is the health piece of it, not the insurance and the cost piece of it. But yes, we do have, I can assure our audience that we have good self-pay options.
Right. And sometimes not only, was writing the big check is that you can work out something over a period of time too, that's
Correct.
included in that, correct?
Correct. Yeah.
And let's go ahead and obviously outside of that, there are, we've been inundated over the years, I think, with folks sending all over these clinics that would pop up and say, okay, we can make you lose weight right away. And they'll talk about the different procedures that are out there, but really, and I'll bring up the screen now, is that you said there's two common procedures that deal with. One is the sleeve, as it's called, and then the other is one's the gastric bypass. They have more technical terms. Let's talk about the sleeve. That's what I had in 2013. Talk about what that procedure actually is and how it's done now, and what is its advantages and its cons right now.
Yeah. So before we even get into specific procedures, I just want everyone to know that we are in the era of minimally invasive surgery. So there used to be a time when bariatric surgery was risky. It used to be done by open incision. Not anymore. Patients wake up with 4 or maybe in rare occasions 5 small incisions. Each incision is less than a centimeter in size, so really tiny incisions. It takes anywhere from hour to 2 hours for the operation itself, no matter which one we are doing. And it's only either no stay in the hospital or 1 night stay in the hospital for a majority of the patients. So then it gets into the specific operations itself. So sleeve is the most common operation being done in the United States right now. In fact, all over the world. It is relatively, if you think about in the history of bariatric surgery, this is a relatively new bariatric procedure, but we've realized that patients and surgeons equally love this operation because it's quick, it's easy to do, and it has good results. We take away majority of the stomach. We do not do anything else to rest of the bowels. We do not reroute anything. We're just taking majority of the stomach away. And the thought is not that you just eat less. There are healthy hormonal changes in the body that happen with this procedure that lead to the weight loss. It's a good procedure for most patients. However, there is a slightly not slightly actually, there's a higher risk of reflux disease with undergoing a sleeve gastrectomy. On the other hand, if we look at the Roux-en-Y gastric bypass, in this we create a small pouch and we reroute the small bowel. However, we're not taking anything out of the body. This is this procedure again not only works by decreasing the portion size that a patient can take in, but it also affects again the same kind of hormonal changes, and especially for diabetics, this is, or patients with heartburn or reflux disease, this is the gold standard. It's personally one of my favorite procedures because it has withstood the test of time. A Roux-en-Y gastric bypass has been around for a long time. And again, at the time when it used to be open surgery, it was a different story. But now with minimally invasive surgery, the risks of this procedure have gone down significantly. In fact, actually, recently we celebrated in the bariatric world the fact that bariatric surgery now has less complications than even a gallbladder or getting your appendix out.
That was something that struck me when you said that Monday. I was like, wow, that has made the change, because the gastric bypass has been around since about early 90s, and it's been refined over the time, but it has now become that more commonplace, that it is something that that is safer over the period of time based on just the data that's out there. Why do you think that is, that it's been able to do that? Just because there have been so many done and it's been around longer, or just that it's, that it's not as drastic of a change to someone's system as they may have thought before?
I think it goes back to minimally invasive surgery becoming more common, right? So minimally invasive has changed the game a lot. And I would say actually it has changed the game completely. The other thing is we've standardized care of bariatric patients. That piece of doing preoperative education is really, really, really important. And I cannot emphasize enough, because in that pre-op part, we're teaching you how to eat, and that helps prevent some complications afterwards. And we also educate patients the warning signs to look for if there's a problem. So patients are being taken care of much quicker. Having that center of excellence status, which standardizes everything. So I think it's over time we have learned from our outcomes, and we've continued improving our outcomes, and we've educated patients before, after, and the standardization of things we do intraoperatively, like during the surgery. So definitely a lot has come together to make the procedure safer.
And one of the things I can share with folks right now is I'd mentioned to you before we went on the air, I had my second consult with the dietitian last night, and which is part of this program. And in each conversation, not only will we talk about, okay, what are you doing now? This is what you need to be thinking about, what you're going to be doing after.
Yeah.
And that is something I will say is a drastic difference between what I went through when I had the sleeve done in 2013, as we prepare for the gastric bypass for sometime this year, is that we're talking about the whole process and not just, okay, here's what you got to do to get ready for the next step.
Yep.
I mean, that's done too, but it's talking about the steps after the steps after. I mean, even talking about, what you're doing week 7 after surgery, and week 2 after the surgery, and week 40 after the surgery. That is a big change. It is, I call it just the more information, the more sharing with the patient, where they are intimately involved with the whole process, not just, hey, I'm showing up and reel me into the operating room and send me home at the end of the day, and here's my instructions, like you do, like some people would think about. Talk about how that alone, that educating of the patient, has really changed the outcomes here.
Absolutely. And then afterwards, we see patients at 2 weeks, at 4 weeks, 4 to 6 weeks, 6 months, and at a year's time, and then yearly from there on. So it's not like, at some point we say, okay, now you're too far out from surgery, go away. That's not a thing, because it's a lifelong journey. Surgery is the easy part. I say to folks, let me worry about the operation.
Right.
Let me take care. I know that's the most anxiety provoking piece for patients, but I will take care of that piece. Pain will go away. We will take care of pain, nausea, any of your other medical piece of it. But it's the diet that I need patients and the lifestyle change to take care of and worry about and focus on. Everything else, the surgery piece, let me worry about it.
Right. Here's Rosalind Muir had something that came up, and you and I talked about this the other day, so I thought I'd bring it up now. She says, you're on gastric banding. At a time we heard about lap band, which is the common term for that. That was kind of a fad within this for a while. And you have a definite opinion on this that's probably not too different from Rosalind's here as well, of how that's looked at now.
Yeah. So I am not a big fan of the band, and I think most reputable surgeons in the country are not. But we realized, of course, at the time, hindsight is 2020, right? At the time, people thought this was the best thing since sliced bread. Like, you just get a ring around the stomach, it prevents you from eating a lot, and there you go, weight loss magic. Unfortunately, we realized that the band, it did not give the exact results, because it doesn't cause that other healthier hormonal changes that I've been talking about with the sleeve and the bypass. That's why the effects are long lasting.
Right.
With the band, it is just a physical restriction. It doesn't help our brain, and it doesn't help our body to feel less hunger or have the healthier changes. And then we realized there was a high risk of complications, risk of slipping of the band, erosion of the band, and ending up inside the stomach. And then overall, if that doesn't happen, then just from chronic obstruction around the stomach, the esophagus or the food pipe just weakens over time, and people are not able to swallow the way they could before the band.
Yeah.
So yes, I recommend to everyone who has a band to get it out. And there are other options that we can then offer in place of the band.
Yeah. I think one of the things too, to kind of touch on, because you said the surgery is the easy part. It's also not the end of the road. It's part of the journey. It's kind of the first step. And Malcolm Galladay pointed out something that's pretty good. He had the gastric bypass in 2006. Said felt great, lost 160 pounds, but then he gained back 140 pounds. And nothing, no judgment on you here, Malcolm. I just want to point out overall when that happens, we've seen is it's because someone is focused, and I say someone, that sometimes it's the clinic itself is focused on the surgery only and not what happens afterwards. And I think the line you use the most here today has, we're friends for life after this, is that we're not getting rid of you. That type of thing. It is all right. After you've done this, are you following your path? Here's what we can help you with. That's where the individual part does come back into play some as well.
Right.
Can you address that? Because he's not the only one. The reason I'm back with you is because of what I did in 2013. I'm not saying it didn't work. It worked, but then lifestyle changes came, everything else, and that became a struggle again for me. And now I'm back up to a level I was. Let me just tell you, Malcolm, myself personally, don't be defeatist about that. That's the first thing. It is, you got this. So that was one thing I'd like to give you advice on, no matter what. And I think it's the same advice I've heard from you, Dr. Samarine. But can you address that? Because there are folks who have found it disappointing, and they may have paid out of their pocket for it and found themselves, years later, like, oh my gosh, I'm not happy with this at all. I'm back to where I was. I'm not healthy. I'm not feeling good. Can you address that for him?
Yeah. So bariatric surgery is a tool. We can do the best operation in the world, but if we don't have the right diet and lifestyle, the weight is going to eventually catch up with us again. So that's why I have been focused so much. I think if folks have noticed, we're talking less about surgery and we're talking more and more about lifestyle before and after.
Right.
And so surgery is a tool, and we're here to support you in the long term, and hence the long term follow up and care. But again, we got to be able to forgive ourselves. So just like you mentioned, TJ, that you regained weight as well, but that
Right.
happens when we have lack of support.
Mm-hmm.
And then we are all humans, right? We sometimes fall off the wagon, and it's okay. Forgiving ourselves and getting back up and saying, I can do this, I am capable, I'm going to put this tool to use again. And then we can help you. Sometimes, of course, there are certain situations patients need revision, and just the present tool that they have may not be working for them anymore. So whenever a patient comes back with weight regain, there are two things we evaluate. We see, okay, is this a tool issue? Do we need to fix the tool? Or is it the patient needs more support?
Mm-hmm.
And it may be both, it may be one or the other. And so that's why we need to check on every single patient individually and decide what the best treatment in that situation is.
And I mentioned this, by the way, to Dr. Akazi and Dr. Gomez back in the day when they were running the program there, that one of the things is I looked all around. I saw the advertisements. I'd go into Houston and stuff, and I kept getting this feeling that I was dealing with snake oil salesmen, that they were selling the surgery and not what you're promoting, which is, again, most of our conversation has been non-surgical. It has been about the other parts of this process. And as I said, it goes from a 2-page flyer now to an actual booklet that you can read through, and that is a good guide for you. And you can even find out more as we have it on. You can take the link to it there to find out more about Dr. Samary and her work at the clinic there. And you see the number at 832-505-1800 to call. But that way you can get some more information on that, on what may be good for you. And also too, you mentioned to me the other day, you have these group meetings with folks that have started up again. Can you talk about those, and can anybody attend those, or does it has to be someone who's already in the program?
Yeah, so it's for our patients. It's for patients who are already in the program, in the sense before or after surgery. We don't differentiate between that. But we are starting support groups. In fact, our first support group is tonight. So we want to encourage folks to join in, and we're going to hold support groups once every couple of months, and there's going to be a different topic every single time. So for tonight, we're going to talk about all the new beginnings, since it's the new year. So we're going to talk about how to jumpstart things and how to get back on track, and or stay on track. So I'm really excited about our first support group tonight, and then we'll be doing these every 2 months, and with a new different topic every time.
Would that be a good introductory thing for someone who's thinking about this before or should they come and meet with you first and then consider going to one of these support groups just to hear what's happening there? What do you suggest?
Yeah, right now it's only for our established patients. I think for somebody who hasn't talked to us already may get overwhelmed, honestly.
Right.
So I think that's why we have, for now at least, kept it only for patients who are already met us, already have a relationship with us. But maybe in the future, I think, TJ, this may not be a bad idea. We may have to and open it up to everyone and anyone.
Let's count this show. Yeah, let's count this show as the first support group that's open for anybody. How about that? We can do it this way. So that's a way to do it. Another question that came up from one of our viewers, Angela asked, is I had a bypass in 2020. How can we get a checkup if surgery was done by a non-UTMB doctor a few years ago? Is that a thing? And you told me it is. Actually, you have patients that come to you that had surgery done elsewhere, and that was it. It just kind of everything went by the wayside, and they don't know what to do. They can come and at least have a consult with you just to see, so you can check them out and make sure they're still healthy and see if more needs to be done, a revision or something else. Correct?
Right. I'm happy to take care of patients. That's my job. We usually encourage patients to, since they may have a relationship with their own doctor, so we encourage patients to stick with their own surgeons. But at the end of the day, listen, my job is to take care of patients. I'm passionate about this. Anyone who comes to my clinic, I never say no.
Yeah, and so it is interesting because now we're seeing a lot of folks comment how the surgeries have helped them out. But as I told you about this, I mean, it's like with any kind of, I call medical fads that will hit, that we'll hear a lot from people who will that go to something and the holistic approach wasn't there. And that's one of the reasons, folks, we wanted to have Dr. Samarine on, because right off the bat I could tell, in talking with her, yes, UTMB sponsors this program, but Dr. Samarine, I didn't have to beg hard, but I said right away, I said, in fact, I will admit to everyone, she and I negotiated this deal while I was laid up getting anesthesia to go in for a procedure.
Don't say that.
Full truth. I wasn't in the operating room yet, but we were already talking about this right before I went in, just to have a checkup procedure. And I'm doing business at the same time. So just to do that. And speaking of which, let's check it, because you sent us some stuff, and thanks to these patients both who sent their own stories and their own kind of testimonies over for us. And we're going to take a look at I was afraid this was going to happen. Sorry about that, Dr. Samarine. Let me bring it up here. I'm going to do this a little bit differently here than I planned on, because this is the video files didn't load properly, so I'm going to try it this way now.
TJ, while you're working on that, I want to address something else.
Sure, go ahead.
While you're working on that, medical tourism, and
somebody commented on that as well, so I went ahead for a mini vacay to somewhere, and medical tourism. Yes, but go ahead and bring that up if you would.
Yeah, so some of my patients and even close family and friends have asked me, hey, I can pay quarter or 1/3 of what I would pay here. My insurance doesn't have coverage, so why don't I go to outside of the country where I can, in less than a fraction of the cost, my travel gets covered, I get this operation, and there I am. Like, why would I get surgery in the United States? I would strongly advise against doing that. And it's not because I'm worried that you're not going to get a good operation. I am worried that you're not going to have the pre and the post-op support that you really need. Surgery is the easy part. It's the other pieces of it that we don't want to lose. And of course, surgery is never without complications. God forbid there's a complication, which I hope nobody gets. But if there is no quality control, and there is no going back and getting it taken care of. The unfortunate reality is these patients are left on their own then.
And it's not as simple as, again, that's where it's taking a look at, okay, we're going to do the surgery. We're going to pay on the few days before surgery, the few days after when you go home, and then they give you a sheet and say, here's what you should do now. It really does happen, when I know, I fully admit this, when I know I have an appointment, which I do Friday with Dr. Samarine, I'm checking myself 24 hours in advance to make sure I've done everything I'm supposed to do, all of that. When you have that pressure going on you, you tend to behave more. Is the best term I would use. That's point blank. And I think that's a good piece of advice. Let's go ahead now and tell us some about this young man here, that one of your patients, that he shared this info with us here today, of his photos here.
Yeah. So, first of all, so that everyone knows, this is being shared with patients' consent.
Right. We have, they've all consented to having this done.
Right.
Here.
I would still not mention any names, but our young gentleman here has done great. I am so proud of him. And I've told him that before, but you can see his journey. He was dedicated to this. He has made, and honestly, he's put in the work. I just did the operation. He put in all the work before surgery and after surgery. And he recently got married, and I am so happy for him. He in his wedding pictures, he looked so handsome, so amazing, and he's healthier. He's now doing things that he didn't do before.
Right.
So I'm very, very, very happy with his progress.
The big thing you notice there too, and this was the thing I did in the face, and I
Yeah.
think this may be this may be the photo from his wedding.
Yes.
Here. I mean, what a remarkable, and how long was this process for him from start to beginning?
So
not start to beginning, from the beginning to where we're at now.
Yeah. So before surgery, it took us about 3 months to prepare for the operation. And once we did the operation, he's about a year out of surgery, a year and a half. And here we are. And he's doing a tremendous job. Yeah.
I mean, that's just remarkable that what he's been able to do there. And we have another one of your patients. Let me go ahead and bring up her photo now, because this is a side-by-side comparison that she sent us. One, I love the dress she's wearing there to the right. That is just outstanding outfit there. But it is one of those things. Beautiful woman, both photos, quite frankly. But again, this is the definition of your definition, and not you personally, but her definition of what makes her feel healthy.
Correct.
And this is again, there is no cookie cutter setup in this. It is an individual goal, individual lifestyle change, individual approach to this. But yeah, I mean, this is just as impressive as what we saw before.
Yeah. And I think she has done great. She, like you said, she's a beautiful woman, right? Before surgery, after surgery. But the key here is she feels healthier. She's more confident. It's all about how you feel, not about just how the world sees you. It's about inner beauty, first of all. And she is beautiful inside and out. She's actually, in full disclosure, one of my close friends. She's like a sister to me, like a family member. And that's why I emphasize to folks that when people feel that maybe, so my biggest worry, TJ, with my patients is sometimes people don't ask for help, don't seek bariatric surgery, because there's, again, that thought in the community that maybe if you're going to get bariatric surgery, it's the easy route, or you're cutting corners and you're not putting in the work yourself, and you're just going and getting surgery. It's not easy. And plus, I believe in this. Hence, I am willing to do it for my best friend or my own family member, which I wouldn't do anything for my own if I didn't truly believe in it.
And that kind of goes, because we're always, as a society, looking for that next magic pill or that magic procedure. And as we kind of wrap up things here, one of the things I want to talk about, there's a lot of talk about the main ingredient in Ozempic, which in Ozempic itself, hard to find. on the shelves for those patients that actually need it, because it was found to help many of those who took it lose some weight. And at what is costing about $1,200 a month in some cases, folks who can afford it are doing it, but they're getting, there are folks who are actually buying it up off the market. And I should point out that doctors are prescribing it still for that. So there's a two-part to that. It's not just people who have the access to pay for it, but their doctors allowing them to do it for this reason. And we heard a lot in the news, like, hey, you get this and you lose weight. We're actually talking about the effectiveness of this, not that you won't lose some weight. There's a good chance you will. But if you are someone my size or more morbidly obese, this is not the route to go either way at this point, because the success of this is a lot different than people are aware of. Can you point that out to folks?
Oh, yeah, absolutely. So medication, I think it's a multidisciplinary care of patients, right? So there's the diet, the lifestyle, the surgery, and then medication, of course. In selected patients, it's the right thing to do.
Right.
It's not for everyone. I'm not saying it should not be done. No, absolutely. Like, for the right patient, it's the right thing to do. But key is right patient. So the thing with medication, so TJ pointed out, this medication was first designed for diabetic patients, but then we realized that it causes weight loss at the same time, which is great, right? So then FDA recently did approve it for weight loss as well. Semaglutide is the generic that is
Right.
the ingredient of the medication. Now, tolerance is an issue. Not every patient is able to tolerate the medication. So, of course, side effects is one thing. The second thing that patients can run into is not enough weight loss, because the average weight loss, and now some patients, I'm just talking average,
Right.
Average weight loss is about 15 to 30 pounds. Can some people do more? Absolutely. However, once you stop the medication, again, you can get weight regain. So in the right kind of patients who have diabetes and are not overweight, absolutely the right thing to do. But if folks are in the morbid obesity side of things, it's probably not the right medication for weight loss.
Because if you're looking to lose 100 pounds and keep it off, that's not the route to go. And
Correct.
the thing that you had pointed out to me that I had not seen in any other reports about the Ozempic style approach was that it is on average, as you said, about 15, maybe 30 pounds. But the moment you stop taking it, all of a sudden you're back to where you were there, because the hunger pain come back, and it actually is almost triple fold. It's your body's gotten used to one thing, and now you've taken it away and your body's starving for that. So it's going to find some other resource to do so. It's almost like a withdrawal in some ways. Just the withdrawal here is that you start putting on weight again. And so I'm glad I want to point that out, because we're seeing that. And at the same time, I'm feeling the struggle of diabetic patients who need this medication. Really has proven to be so effective with battling diabetes, and the weight loss side of it has helped in that as well. That I would just discourage anyone, and particularly too, as I say, it takes two to tango in this case. It's not just the patient in this case. There's a doctor writing that prescription,
Right.
and they know what it's for.
Correct.
And it's the do no harm aspect of this. Some folks may need to be thinking twice before they sign the pen. That's a whole different thing when we get into medical ethics and the like as well. And as I expected, I warned you this would happen. We would go over from our hour-long show here, Dr. Samring. But first up, I should point out, we've talked all about the surgeries that you do on the bariatric side. That's not all you do. You're actually quite busy with other things. So talk about that and how those tie in with your surgical procedures as well. Particularly if
Yeah,
you've got a hernia, this may be the person to see.
yes. So I am a general surgeon, first of all. That was my basic training. And then I went on and specialized in minimally invasive and bariatric surgery. So I do take care of bread and butter general surgery like gallbladder and hernias. But my passion that I also trained for, along with bariatric surgery, I'm as passionate about reflux disease as bariatric surgery. How it ties in is reflux or heartburn is unfortunately becoming more and more and more common in the United States. And it sometimes is associated with obesity. So, with or without obesity, heartburn rates are going up. So, yes, hiatal hernias, heartburn, gastroesophageal reflux disease, other gastric tumors are another area of my specialty because I am in that, I operate in that area of the body every day. So I take pride in providing complete care to my patients. If they have a upper GI issue, I am happy to take care of folks.
Well, and I should point out, again, I've been sharing a lot of my personal stories, and I should note this will be not the only time I do that. We're going to do something outside of that. Those who remembered, I did an award-winning blog when I was with the Galveston County Daily News. It was called Fat Boy. And you saw the photo of the young man with the sweater of the sweatshirt earlier. I have a similar series photo with a pair of jeans I actually still own, but now they fit a little more snug than when I did there, and I've kept them for this purpose. But we're going to kind of start that up again as well. As Dr. Samring is probably going to be my guest a whole lot more throughout the year as we do more of this personal journey, maybe not live all the time, but as we go in. And if I can just point out to you, one of the things I enjoy she's a straight shooter. One,
Yes.
She's got a great personality. Two, and the other part of it is, and this was important to me, is that my wife was there with me when we were going through a procedure of the day, and she made sure she just wasn't addressing me in the room, but also talking to my wife at the same time. So when you have your loved ones with you, you're in there and the like, and you believe, as I do, of making sure that everyone who's involved in this process understand what's going on, it is good to have a doctor that doesn't talk over everyone's heads. And I do appreciate that of you. I know you didn't know that was coming. I've told you that personally, but I wanted to make sure our viewers knew that too, that already this is somebody I trust a great deal, and hopefully you will as well. Her contact information is on your screen now. And a reminder too, for those of you, we had a lot of viewers join us late in the show. And as soon as we end up this program here, it'll be available for replay immediately. And so you can do that. And if you have any questions, you can post them. We'll forward them on to, instead of posting them, send them direct to us. I know I just asked Malcolm, who had some comments with us, to send along information to us as well. And I'm going to pass along information to him so he can find a way to do that. And then for everyone else, as I said, if you're thinking about this at all, don't hesitate to just find out about it. And that's the most important thing. Yep. Investigate first. Don't just think it's you and think you got a problem. Go ahead and try it out.
Make an informed choice.
Yeah, that's the important thing. Informed choice, and you will get that in this office there as well. And again, I'm one of those that appreciates that. Every question I have, I've had answered, and trust me, I'll ask a lot of questions about things, even things I'm familiar with, and I've learned a lot here. And it's a chance for you, and hopefully those of you watching the program today learned a lot as well. Dr. Samring, thanks for coming on all this. We'd appreciate it.
It's my pleasure. Thank you for having me.
All right. That's Dr. Sarah Samring, the Metabolic and Bariatric Program at UTMB Health. We'll see you next month, the February issue or episode of Healthcare Unmasked. Becky hasn't given me my orders yet. At some point, we'll have the topic here for you, sure enough. I'm TJ Alt, I-45 now, and Galveston.